Hello, this is Kara Mudd, Dermatology PA from Louisville, Kentucky. I want to take a few minutes to speak to you about the use of topical ruxolitinib in our youngest pediatric patients. As you likely know, the use of topical ruxolitinib was approved for ages 2 to 11 years of age this past fall. And with that approval, we continued to see the same efficacy and safety that we've seen across the other indications and age ranges for this medication. In the True AD3 study, we saw that over 56% of patients were able to achieve clear to almost clear skin by week 8, and actually a third of those patients were able to achieve clear to almost clear skin as early as week 2. And then after that initial study point, participants were enrolled into more of a long-term extension study where they were able to use the medication intermittently. So they would use the medication for flares and then pause once lesions were clear, and then pull out the medication again for repeat use if necessary. This also gave us the data to show that on average, patients were able to be off of medication or any type of treatment therapy for approximately 5 months out of an entire year. And approximately 70% of those patients were able to, again, continue to maintain the clearance of the 0 to 1 IGA scores for well over a year. So I think this really speaks volumes to us to know that we have a good, strong, efficacious non-steroidal that we can turn to for those atopic patients. Not only is it efficacious, but it's very safe as well. In that True AD3 study, they did not see any new safety signals in that younger pediatric population. And in the plasma concentration studies, there was no evidence of increased activity, or there was no evidence of the plasma concentration meeting the levels that would be required for any type of systemic absorption or adverse events from those areas. So I think in summary, it's just really important that we continue to remember that our atopic dermatitis patients really need to be treated and treated well early on to improve that overall quality of life. And now we have so many tools in our toolbox to reach for that are non-steroidal options, which is also very important. I think clinically, it's just important that we are just good stewards of the use of the topical corticosteroids. You know, we're used to this with our antibiotic stewardships, but we really have to hone that back in when we're treating these atopic patients as well. For me personally, the use of topical ruxolitinib cream has really been a game changer within my day-to-day clinical practice. I'm able to reach for a very efficacious and safe medication for my chronic atopic patients without oftentimes having to turn to systemic medications. And patients are able to use the medication intermittently. The parents and caregivers feel good about using the medication, knowing that it's not something they have to use long-term, and also knowing that we're not going to have the long-term side effects of the corticosteroid use.